When training in a classroom setting, you can now see real-time feedback of all the critical factors to obtain quality CPR. Correct hand placement, adequate compression depth, release, and rate. The arrows indicate inadequate depth or release. Ventilation volume. Excessive or inadequate ventilation volume is indicated with a yellow colour. As instructor, you have a full overview of each student's performance in the classroom. Each student can be given constructive feedback while giving CPR. The summary screen gives instant feedback of the session in order to debrief the students individually. Up to 6 mannequins can be controlled wirelessly using this software, making it perfect for a classroom setting.
My name is Cindy Nelson. I'm a registered nurse with a CCRN certification. Now that you've seen the beginning of simulation learning on the video, we will discuss 21st century learning and simulation training. History has proven that simulation learning saves lives. Nurses do not question the need for BLS or other simulation-based certifications, but they tend to balk at the idea of a simulated or fake patient. Acceptance being slow during the first 40 years, you can see that it started as late as the 1960s and the resuscitation in about 1970. Sim technology has now become a worldwide method of student learning. Sims provide many of the nurse self-evolving effects. In our present reality, there are sim centers in most major hospitals. Students tend to participate reluctantly, wanting to get their hands on the real thing. Related to a need for safe application of theory, critical thinking, and utilization, Sims provide the missing links while supporting quality assurance and efforts for management. In early 2012, robotics firm iRobot built the Remote Presence Virtual and Independent Telemedicine Assistance, or RPVITA. It is pictured in the upper right-hand corner. Provider consults occur remotely or can occur on a stat basis. Considering utilization versus malpractice claims and med errors, they have proven sim learning to be cost-effective. In the bottom picture, you can see the first drone-delivered defibrillator designed by a Netherlands graduate student. It cuts delivery time by 90%. I highly recommend you watching a video presentation about it on the link that I provided under references. Due to technological issues of ethics and autonomy, fully robotic nurses are not ready for market use. Here we will look at simulation and how it helps nurses achieve and sustain good practices. Establishes an engaging learning environment, maintains, explores, and identifies performance gaps. Organized debriefing ensures self-reflection, quality, and safety in a positive way. And this provokes critical thinking, adjusting for future performances. Simulation learning theory. Instructors use standardized methods of evaluation and performance. Safety and student skill level are priority 1. Interview of the sim mannequin includes subjective, objective, and technical representations of healthcare needs. Care is patient-centered and a debriefing session occurs at the end of the scenario. The final event is an evaluation and score of overall performance, which provides immediate feedback. You will see a picture of standardized nursing care. This is based on the method of assess, plan, implement, or intervention, and then evaluation. All of these methods include outcome development based on analytics, performance process, 24/7 care reviews, and evidence-based practice. We cannot go further without considering outside the clinical environment. University of Minnesota is one of many highly known centers for advanced student-centered active learning environments. In the left picture, you can see a design providing interconnected learning methods where it is student-centered and the instructor is able to rotate between tables as necessary. In the right picture, a student nurse is fully connected to her learning environment on and off the campus. Still considering 21st century active learning, simulation learning, thinking, and being part of the movement? If you are considering being part of what we call a progress towards clarity and involvement in high priority nursing care, please use the supplemental tools at the University of Minnesota by going to this web link and view the multiple connections for active learning and simulation training. This is at the University of Minnesota. Then if you have questions, you may use the support menu on their site. There are many tools for both instructors and students. I thank you for your time and consideration. Here you will find many, many links to some of the points that I have put forth for consideration today. Thank you again for your time, listening, and involvement, and I hope that you enjoyed my presentation.